Welcome back to my channel. My name is Becky Sechere. If this is the first time you're watching my video, do not forget to subscribe before you go away. If you're already a subscriber, thank you very much. So today I'm going to be talking about a day in the life of a UK sickle cell nurse specialist, because that is what I do and I wanted to share with you what I do. Unfortunately, I couldn't do it live at work because, as you know, you have to ask permission and all that. So specialist nurses in the UK are not many, and we don't have too many centres, but comparatively I think it's good enough and the numbers are growing. There are two categories of sickle cell specialist nurses. We have clinical nurse specialists, and then we have the community nurse specialists, who are referred to as nurse counselors. So we both work interchangeably, but sometimes certain things we do are very specific. So in a day, what do? I wake up at 6 o'clock, I get my shower, I have to make breakfast for myself and my 10-year-old, and I have to prepare pack lunch for both of us, for me to take to work and he to take to school, because he doesn't like the school dinners, he said. Anyway, so after that, he gets ready, I get ready. I start work 9 and I finish at 5 o'clock. I haven't got parking space at work, so I don't drive to work. So I walk about 10 minutes to the bus stop and get the hospital bus straight to work. So when I get to work, the first thing I will be doing is to listen to messages on our answer phone to see if any patient needs help or anybody wants to change the appointment. After that, we receive our referrals through email system from the laboratory or other health professionals. So I'll be checking email for the results or referrals that we have got. I look at the results, I allocate, and then the next thing is to check my emails as well itself to see whether there is anything I need to be doing or I need to be answering any questions or queries from anybody. After that, I go to clinic. And so when I go to clinic, there are different categories of patients that we see in our clinic room. So one of them, the main one I would say, is antenatal women. So any woman pregnant in the UK would be offered screening for sickle cell or thalassemia. As you may know, these are genetic conditions that can be passed on through parents to their children. So I see antenatal women. I would see anyone who is going through assisted conception and have been screened and found to be carriers for sickle cell or thalassemia or any related conditions. We also see parents of babies who are born with they are carriers or they have got the condition as well. So a typical day, I might be seeing antenatal women whereby she would come into clinic. We advise they come with the fathers of their babies, biological fathers, so we can give them information about whatever she's a carrier for, whether it's a sickle cell, is a thalassemia, hemoglobin C, D or E. And we would give them information about how that affects them individually and what the reproductive implications are. And then we offer blood tests to the father of the baby to help us to assess whether there is any risk of a major hemoglobin disorder to their baby. So after that, what would I be doing? I would be putting his details in my diary so that in 3 to 4 days time, I would check and find out whether his result is back. Is he a carrier? Is he not a carrier? If he's a carrier, I would have to bring them both back into clinic, give them information about the implications of them as sickle cell carriers. Then it means that there's 25% chance they could be having a child with sickle cell disease. So I'll be telling them about what the effect of sickle cell disease, the implications, how we manage children with sickle cell disease, and the choices that are available to them. And if they would like to just wait, have the baby and get the baby tested, we would do that. If they would like to actually find out during pregnancy whether the baby is affected, we can refer them for these genetic testing, we call it prenatal diagnosis, and then we would coordinate the test, wait for the result, and I'll be ringing them and telling them. So each day is different. Every day there's a different thing you happen to be doing. Sometimes you have to be teaching, you have to be mentoring student nurses who have come to learn about sickle cell and thalassemia, because these conditions are not, they are very rare, I would say. Supporting patients as well. If one of the staff I work with are on annual leave, I would have to cover for them. We do so many different things. So each day, as I said, is very different. We have meetings as well. And then after that, I jump on the bus and I get back to work, and I have to cook and then carry on. So basically, this is what a normal day of a sickle cell specialist nurse in the UK is like. We are autonomous practitioners, however, we do have our consultants who oversee what we do, so that in case you find a situation you feel, I'm not really sure what to do, I would be discussing with our consultant. Hope to see you soon. Remember, like, subscribe, and share. And take care, and I will see you again next week. Bye-bye.